Thank you everyone for being here. I'm very excited to be hosting this discussion. I'm going to take a little while and speak, but I'd really love if afterwards we can share our stories, our insights, our resources, so that we can help bridge this gap together. So without further ado, again, welcome to Black Health Matters, a webinar. I'll introduce myself. For those that don't know me, my name is Nicole Christensen. I am the CEO and founder of Care Answered. We provide patient advocacy and healthcare coordination. Our vision is that all people can easily access the care that they need. I'm also the author of From Crisis to Calm, a patient advocate's take on healthcare coordination for you, the common caregiver. And in these circumstances, probably what best describes me always is I'm a patient, just like every single person. So I'm a patient. I was a daughter of Black patient parents. My siblings are all patients. I'm a mother. I'm a niece and a friend and a community member surrounded by Black patients and in our world that need access to care. And that's for all of us. So what we're going to talk about today is kind of the history that's causing the distrust in the healthcare system for the Black community, what current disparities that we face, and what we can do to bridge that gap. So let me start by talking about the unethical medical research. I think many of us know about the Tuskegee experiment for untreated, basically syphilis on men from basically 1932 to 1972, where men were told they were getting some kind of free treatment, but they were utilized as an experiment. They were given things even past the time that it was known that penicillin would cure syphilis. And again, this went on and many men died from it till 1972. There were also other unethical medical research on African-American boys to study the aggressive behavior, where they were given their parents were given monetary help or monies to then experiments. They stayed away from their home. They weren't given their medications, their regular medications, including asthma medications. They went without water. They were given injections. They had blood drawn hourly. And of course, this was unethical. And then if we just look at the history of African Americans in the United States, the ethical treatment is also clearly not there in general, regardless of health matters specifically. So there is a history and there's a reasoning that's very clear as to why that distrust is there. But what can we do, what we're going to talk about to remedy that? So this distrust is persistent. And some of the causes of that are the healthcare disparities and implicit bias. And so we're going to talk a little bit about that, about what's going on. So when we talk about cancer rates, I know there's a lot of numbers on here, but just in general, from the American Cancer Society, from US research, they state that African Americans have a higher cancer burden and face greater obstacles to cancer prevention, detection, treatment, and survival. And in fact, Black people have the highest death rate and the shortest survival of any racial ethnic group for most cancers. We also know that African Americans experience more illness, worse outcomes, and premature death compared to whites. African American men also have the highest cancer incidence. Prostate cancer death rates in Black men are more than double those of every other racial and ethnic group. Black women are 40% more likely to die of breast cancer than white women and are twice as likely to die if they are over 50. About a third of African American women reported experiencing racial discrimination at a health provider visit. And lastly, living in segregated communities and areas highly populated with African Americans has been associated with increased chances of getting diagnosed with cancer after it has spread, along with having higher death rates and lower rates of survival from breast cancer and lung cancers. And when I was speaking to a member of the employee of the American Cancer Society that is the director of health equality, she was also sharing with me that studies have shown that the African American population, even when diagnosed, don't necessarily share it with their loved ones. So that support system can also be lacking. And let's talk about other illnesses. So pregnancy-related deaths per 100,000 births is 4 to 5 times higher for Black women. Then with dementia, age-specific prevalence, 14 to 100% higher in African Americans. And then about 44% risk of dementia for African Americans if the first degree relative has Alzheimer's disease, which affects so many of us. And when listening to the Alzheimer's Association, when they were talking about disparities in those diagnosed with Alzheimer's, they were talking about just being born Black gives you a higher rate of getting dementia, the stress that's involved with the everyday living. These are scary statistics. And then you'll see on this slide also about diabetes and the death rates. Again, a lot of numbers, but you'll see at the end the death rates, the total for non-Hispanic Black population is about 39% versus non-Hispanic white population being about 19%. So these are just facts and figures and knowledge. And now we talk about COVID. We're in this pandemic that probably most clearly shed the brutal light of the fact of the healthcare disparities. So according to the New York Times article that came out just last week, the death rate from COVID-19 is almost 2 times higher in Black Americans. The life expectancy, as far as the first 6 months of 2020, is 2.7 years, has decreased the life expectancy. And we made so many strides in the past decades, and it's bringing down, kind of erasing all of those strides. And then it's unequal. As we talked about the disease in the African American population, often they're chronic diseases. So when then afflicted with COVID-19, it has obviously worse outcomes and there's less support. And then when we talk about access to the vaccines, again, unequal access to the vaccines in many communities. So I'd like to talk about what implicit bias is, because that's part of the problem, and knowing about it, I believe, is part of the solution. So according to NIH, implicit attitudes are thoughts and feelings that often exist outside of conscious awareness, and thus are difficult to consciously acknowledge and control. And we're going to talk about a little bit about the test, the Harvard implicit bias test that's available, and I'll have the link to that. But it also says, despite all of the advancements in healthcare in the past century, disparity based on race and ethnicity persists in access to healthcare, quality of care received, disease incidence and prevalence, life expectancy, and mortality. Again, going back to all the diseases and the statistics that I shared before. So it plays a huge role. And there's many studies that show this. This is not, maybe it is, maybe it does play a role. It has been proven time and time again. So I love this quote by Maya Angelou. Do the best you can until you know better. Then when you know better, do better. So that's what I'm asking of every person, and myself as well. So when I talked about myself, one of the things I, of course, shared is that I'm a board certified patient advocate. So kind of doing the best to advocate for yourself or a loved one is certainly in my wheelhouse. But especially with the African-American population and Black and Brown communities, or any minority community, it's just even that much more important to stress and to share this information. So the steps that I suggest are empowerment, right? As patients, we are the experts in ourselves. You know, medical doctors, all of our providers, they're probably very well versed in many things. Smart people, went to school for a long time. However, you are the expert on you. So go in there with the knowledge that that is the case. If something sounds wrong, or you don't understand, or it doesn't sound like what you're saying, or they're not listening, then you need to walk away and find another provider. Also, sharing your knowledge. So share the knowledge with other patients, which are everybody around you, that they also are the experts in themselves. And share your knowledge and your experience and all the resources that you have as far as information. Any information that's new from this webinar or from all the things that we learn, share it with people so that they can be better equipped, your whole community. Now, selecting a physician, right? So we're talking about these implicit biases that may be in your provider, in your physician. So how can we kind of not have that happen to us besides the empowerment? Selecting a physician. A lot of people just getting their hair done. Select a beautician or a stylist that looks like them or have a lot of experience with their type of hair or the kind of style that they want. So why wouldn't we do the same for our doctor? It's so important. So one could be look for doctors that look like you, or ask the office, you know, what percentage of patients are my race, creed, color, sexual orientation, so that you can know that this might be a safe place to be, that people, that they may not have that implicit bias, that you feel that you can really bring out all the questions that you have and get them fully answered. This is so important because health, although it's everyone has it, right? It can be very personal. So you want to make sure that that person, that provider is really listening to you and understanding you. Ask questions. So one of the things that is true in the United States is that our healthcare literacy is pretty low, which means our ability to take action and act upon medical information given to us is not really good. We're not really great at it. So again, empower yourself. Ask the questions until you get it. It's not okay if you don't understand even a little of it. If you're unclear, ask the question then. Don't be afraid. It is your life. Prep for appointments. You have a doctor's appointment. You know, you're not going to remember all your questions. Nobody does. So make sure that you're prepared with the questions that you had a week ago that you said, I'm going to ask my doctor next time. Make sure you have that with you and that you write down all of the answers. This is going to be your own record so that you have that information. In my book, From Crisis to Calm, it has places to write. The questions are commonly asked and places to write the answers, but you can make your own. Make it a healthcare notebook. Have your list of medications. Know all your medications, the dosage, what you take it for, when you take it. Include supplements and vitamins, everything that you might need. And access to medical records. Now there are often available portals, right, and apps to get your information. Sometimes the information gets there late, so it's not 100% all the time. So it's in addition to what you're writing down. But access those medical records through a portal or get your copies of your medical records on paper. This is going to be very important for you because, again, if we go to the doctor and we feel like they're not really getting us or answering our questions effectively, or we feel like they're treating us differently than we expect or we should be, we want to make sure we have all of the information from our medical records to now then choose another more appropriate clinician. So we're talking a lot about health, but there's so many factors that affect our health. So I just have some links here. I have I've done a lot of work in social service, nonprofit, in minority populations. So I just wanted to bring it to light, and maybe at the end, people can add to these resources and information. Access to health insurance. It's very real. It's a huge problem. What I have here is it's basically access to Medicaid and other insurance providers through Obamacare, so that people have that information to know what's out there. Access to healthy food, also a huge issue that impacts our health. So I have here the 2 food banks on Long Island, as well as the Catholic Charities on Long Island that also help with WIC and food stamps called SNAP Now. I have the information. The last one is the Food Bank of New York City. Again, there are so many resources, but those are the ones that I have listed. And then there's education. Again, all affecting our health, especially in this pandemic. Those of us who have children or are children, getting that access to education is so vitally important and so much more difficult. So many people in minority communities do not have access to the Wi-Fi, and they're going to school remotely. There's got to be an answer. We can't just wait. So talking to your school district, legislator, or a community-based organization in your area, or members of a community to try to figure out an answer. And these, again, are some of the resources that I have to share with you. The first one is blackdoctor.org. It's to find a Black doctor. So it's, you put in your, zip code and what kind of doctor or specialist that you need, and see if they might be a good fit. The other is Ask for Your Life. I learned about this really important program through Pulse Center for Education and Patient Safety. Patient safety and education. And so Ask for Your Life is particularly targeting Black communities. Again, making sure that we're asking all of those questions when we're at a clinician's office and getting the answers that we need. The racial equity tools that's listed there is, again, for broader advocacy. It has many different things, ways to get involved and learn. So it might be a good website to check out. I also really recommend the podcast, The Healthcare Confidential. It was particularly interesting. Many of them are, but I was listening to this one by Dr. Robert Roswell. He's at Northwell, and he discusses at length healthcare disparities, and on the provider side, trying to make sure that providers are aware of their implicit bias and how to kind of combat that. The more you know, the more you can make changes. One of the things that spoke to me that seems really similar to what I tell my clients is he's suggesting that providers take a moment, take a breath, and think, is this the route I would take if this was my sister, my brother, my mother, my friend, so that they are not feeding into their potential implicit bias. So I thought that was really important. And then the next one is the implicit Harvard, the test. So you can do that in the privacy of your own home. The truth is, we all have implicit bias. To discover what it is can help us. And then last is the cancer.org that had the information about disparities in the Black community that I found really insightful and helpful. So with that said, again, I shared a little bit of information about what I've learned and what I know, but we're all in community. So I would love if you would be so kind as to share your story or your concern or your resource.